Welcome to an AFSA presentation on atopic dermatitis, more commonly known as eczema. This presentation has been kindly sponsored by AbbVie. If you're living with eczema, you might wonder, why is my skin itchy, red, and dry, when others around me don't have this problem? People with eczema have skin that is more sensitive, losing moisture more easily, which causes dryness, itchiness, and inflammation. This extra sensitivity often runs in families, so if someone in your family has eczema, hay fever, or allergic rhinitis, sinusitis, itchy eyes, also known as allergic conjunctivitis, or asthma, you may be more likely to have it too. Eczema happens because of differences in the skin barrier and immune system. In people with eczema, the skin has a harder time holding moisture in and keeping allergens, like pollens and dust, out. This causes the skin to dry out quickly, become itchy, and react more strongly to things like soaps, dust, or even weather changes. Not everyone's skin reacts this way, but people with eczema have skin that is more sensitive to these triggers. Can eczema lead to other allergies? If you have eczema, you might also have other allergic conditions, like asthma, which is trouble breathing due to sensitive airways, or allergic rhinitis, which is sneezing and itchy nose from things like pollen or dust. Doctors call this connection the allergic march, where having one allergy makes it more likely that others will appear. Having eczema doesn't mean you'll automatically develop these conditions, but it does increase the chance. This program is here to help you understand why eczema happens, how to manage it, and what steps you can take to keep your skin healthy. With the right care and knowledge, you can reduce symptoms and live more comfortably with eczema. We have much to cover in this program. Let's get started with understanding eczema. Eczema, also known as atopic dermatitis, is a condition that affects the skin's ability to protect itself. Eczema is a chronic condition that causes discomfort and frustration. Eczema, also known as atopic dermatitis, occurs when your skin's barrier doesn't function properly. This means it can't lock in moisture or keep irritants out, leading to dryness and inflammation. Triggers vary from person to person but can include soaps, detergents, dust, pet dander, or stress. Eczema isn't contagious, but it often runs in families and is commonly linked to conditions like asthma or hay fever. Great! Now let's find out more about recognizing and grading eczema. Eczema doesn't look the same for everyone, and it can range from mild dryness to severe inflammation. Mild eczema may involve small, itchy patches, while moderate cases cause redness and cracks. Severe eczema can lead to thickened bleeding skin with intense itching. Understanding the severity of your eczema helps determine the best treatment plan for you. If symptoms worsen, consult your doctor to adjust your care routine. Let's find out more about why restoring your skin barrier matters. Think of your skin barrier as a protective wall. When it's strong, it keeps moisture in, and irritants and allergens, like pollens and dust for example, out. But with eczema this wall is damaged, which makes your skin dry, itchy, and more prone to flare-ups. By using moisturizers and gentle skincare products daily, you can strengthen your skin barrier, reduce inflammation, and prevent future flare-ups. This is the most important thing you can do to improve your eczema. Let's look at the daily steps for managing eczema. Daily care is crucial for managing eczema. Start by moisturizing your skin all over regularly, at least 2 to 3 times a day, to lock in moisture and protect the barrier. Use fragrance-free cleansers that won't irritate your skin, and try not to scratch, even when it's itchy, as this can worsen the problem. Finally, wearing soft, breathable fabrics like cotton helps minimize irritation caused by rough materials. Choosing the right moisturizer is important. Moisturizers are a key part of managing eczema, but not all are the same. Lotions are lightweight and good for mild cases or when it's hot outside. Creams are thicker and great for everyday use on moderate eczema. For severe dryness or cracked skin, ointments are the best choice as they lock in moisture effectively. Find the one that you like the most. The one that your skin likes the most may also change. This is normal. Now, how can we safely use topical steroids? Topical steroids reduce eczema-related inflammation and itching, but they must be used carefully. Apply a thin layer to affected areas only, and always follow your doctor's instructions. Prolonged use without supervision can cause side effects, so it's important to transition to moisturizers alone once your skin improves. Ask your doctor about cortisone-free topical treatments. When is advanced treatment needed? Sometimes, eczema can be difficult to manage with topical treatments alone. If your symptoms persist, your eczema affects large areas, or it disrupts your sleep or daily life, your doctor may recommend advanced treatments like oral medications or injectable therapies. These options target inflammation more effectively when standard care isn't enough. What are common triggers of eczema flare-ups? Many things can trigger eczema flare-ups, including harsh soaps and detergents, stress or weather changes. Allergens like dust, pet dander, or pollen can also worsen symptoms. Identifying and avoiding your specific triggers can help reduce flare-ups and keep your eczema under control. When to see your doctor? It's important to consult a doctor if your symptoms don't improve with regular treatments, if it keeps coming back, or if itching disrupts your daily life. Your doctor can help adjust your treatment plan or recommend advanced options to get your eczema under control. What can you do to live well with your eczema? Moisturize daily to strengthen your skin barrier. Try to identify and avoid triggers. Follow your treatment plan consistently and reach out for support and help when needed. Great! You have now completed all of the sections. Thank you for joining us on this eczema journey. We trust that this module has helped you to better understand your eczema, to recognize the symptoms, to know how to gently care for your skin and to moisturize frequently, and to know when to see a doctor. Please join us for the free 2025 Allergy Education workshops. Go to www.allergyfoundation.co.za for more information about your allergy and for the patient allergy workshop dates. As a final step, you are now going to watch a short eczema video.
Eczema is a skin condition that makes your skin dry, itchy, red and scaly. There's no cure for eczema, but there are ways to keep it under control so that you can feel better and do the things that you enjoy.
I always tell Mpilo to use the emollient whenever she feels itchy instead of scratching.
Here's a plan to help you manage your problem. Let's call it itchiness.
I hate my itchiness. That's why I use ointment on my skin every day, even when I feel okay, to stop the really bad flares from coming. My doctor taught me that emollients are a special lotion for my skin to keep my skin moist and healthy. I have to keep putting it on the whole day.
I use moisturizing ointment regularly to manage my child's eczema. They work by making an oily layer on top of the skin, preventing water from getting out of the skin from becoming dry. They should be applied frequently, even 6 or 8 times a day for severe eczema.
My mom says every time I feel itchy, I shouldn't scratch. I should put on more emollient. She showed me how to put it on properly. I put it on gently, but in a thick layer, and from the top of my body to the bottom.
To avoid contamination, it is always better to use a nozzle or to squeeze from a tube. If this is not available, use a utensil and replace the lid as quickly as possible.
When my itchiness is really bad, I use a small amount of a steroid cream or ointment to make it better quickly and to stop the itching and redness. It works really well and quickly to make my itchiness better, and I can stop using it when I feel better and just go on with my emollient.
My doctor also gave me an ointment to use only where the bad places are to stop the itchiness from coming back again. I use it twice a week and it keeps the itchiness away.
I get my itchiness in my elbows, and sometimes I scratch it at night. My mom bought me special elbow patches. I put my emollient on, wet the elbow patch a bit, and put it on. And put my pajamas on top. I always sleep better when I use the patches, and the next morning, my skin feels much better.
It's really important to avoid things that make your itchiness worse, like strong soaps, itchy clothes, fabric softeners, and overheating. Your doctor can help you to figure out what these things are. Aqueous cream may be used instead of soap, but it should not be used as a moisturizer because it may irritate the skin. Managing your itchiness means you need a plan that includes medicines, avoiding certain things, and using emollients regularly.
My doctor knows about eczema and gave me a plan from the Allergy Foundation so I can feel better, sleep better, and enjoy my life with healthy skin.
Help us to help you. Go to the Allergy Foundation website at www.allergyfoundation.co.za and sign up the Allergy Foundation as one of your beneficiaries on your Woolworths My Schools, My Village, My Planet card.